Hello, my name is Dr. Lesia Waschuk, and I'm the Compliance and Education Specialist at Prep Doctors. And today I'm speaking with Dr. Gevik Malkhassian, who is the Director of the Second Year Endodontic Program at the Faculty of Dentistry of the University of Toronto, and also the Director of the International Dentists Advanced Placement Program at the University of Toronto. Today we're going to be talking about careers in dentistry and how new dentists might consider the choices that they have ahead of them. I thought that maybe we'd start with your story. I know that you're an internationally trained dentist yourself, and I mention that because our primary audience at Prep Doctors will be the dentists who take the equivalency process courses with us. My area is continuing dental education, so we'll talk a little bit about that as well. So your story. When did you decide to do an endodontic dental specialty?
That's interesting. When I graduated from undergrad, I was in Iran, and I graduated about 1990. Always you have this question that, should I do specialty? Shouldn't I do specialty? Which specialty I should do? So for me, it was not that clear. So, and also because of the situation that I was in, I decided to go to practice first and to do a general practice, work as a general practitioner. During the years in working in different settings like governmental, public health, private clinics, and all of these things, gradually I started seeing that what I really like. After I immigrated to Canada, that opportunity opened up more, and because I was flexible and I was really interested, and I was actually encouraged by some of my friends to pursue the specialty after getting into the qualifying program, which is now called IDAPP program. Within those 2 years, I also came to that understanding that exactly what I wanted to do. I practiced more than 11 years as a general practitioner. So some people would say that, oh, after that so many years, how did you decide to go back again to school? Well, everybody is different on that, and I decided to go, and I applied, and I was fortunate to get into the program at University of Toronto for endodontics, which was my passion. And then I graduated from there, and I stayed at school and never left the school. So that shows that how interested I am with this environment. I think that was a brief kind of introduction and explanation. Do I need to do anything? Do I need to explain anything more? Just please feel free to ask me questions, and I can give you more details on that.
Super. Well, what strikes me is you said passion. So there was a particular part of dental practice that appealed to you more than the others. And then there was the setting, the academic setting, that you also fell in love with, I guess, and that's why you stayed. So general dentists, who, we have a wide scope of practice. And it could be that a general dentist doesn't have one single passion. They may have a whole bunch of different passions. And so some dentists will do more endodontics in their practice than others. Some will like it so much that they will take a whole series of continuing dental education courses. I think, what would be your advice for a dentist that wants to, a general dentist who hasn't done a specialty, who wants to focus on a particular area, but gain expertise without doing a dental specialty program? What would be your advice?
That, I would say, follow your heart.
Mm-hmm.
Okay, that's what you need to know,
mm-hmm.
what you like now, and where you want to be, I would say, in 5 years or in 10 years. And do not regret what you are doing. For me, I was one of those that took longer for me to understand what I want. Some people, they know from the beginning. Like, I had people who were approaching to me and say, I want to go to dentistry. And I ask them, why do you want to go to dentistry? They say, I want to be orthodontist. Fine. I say, how do you know that you want to be orthodontist? Have you practiced orthodontics? Have you practiced dentistry? But there are people that I know that they have gone through that path. They become they have become orthodontists, and after they have become orthodontists, they said, "This is what I wanted to do," and they were happy with that.
Mm-hmm.
I knew people like before going to dentistry, for example, they went to medical school or they went to dentistry, and they saw that this is not what they want, and they changed. I know people who have gone through a PhD program to do research, and then they have applied to dentistry. So basically, you have to find yourself what really you want and what you would like to do. For me, after many years, I started realizing, I'm not saying that other specialties are not good, but for me, endodontics is what I wanted to do. And I realized that I can be good at it. And that's why I followed it. I was debating for a long time, for example, should I go to prosto? Should I go to endo? I knew that I don't want to go, for example, to ortho. Every specialty has its own kind of passion, that some people are passionate about that, and we are colleagues anyway together, and we are a team in providing a healthcare to the patients, and we want to do something that the patients will benefit the most. And if I'm happy with what I'm doing, I'm happy when I'm sitting, and I know that what I'm providing will be beneficial for my patient, and I will enjoy doing it, it gives me some kind of a fulfillment, then that's what makes you kind of a good provider, probably, I would say.
Mm-hmm.
So that's why I decided to go endo, and that's basically it, I think. There are other things also, like, for example, why to do the specialty for me was that I was at some point that I would say, okay, I need to know more beyond what I know now. Yes, I would read books, I would read journals, but giving that comprehensive, broader look and detailed look that what's going on behind what I know was some kind of a little bit of kind of a itch that I had. So, and I had to kind of fulfill that also, and I needed the answer for that. So that's another reason that I went to specialty. People who don't go to specialty but focus on the technical aspect of a procedure, and they provide what is good for the patient, I admire them as well. And there are many people that they do those things. There are many people I know that they do a lot of good endodontics for their patients. There are many people they do surgical extractions, for example. They do orthodontics. Uh, anyway, but as long as a person knows their limits and knows how far they can go with what they know and provide the best for their patients, that's fine with me.
Yeah, and that's what I was getting at. I think it's the immersion that you get in a particular part of dental practice. Well, a particular discipline, really, in a specialty program, exceeds what we can do through continuing dental education. I think that as long as there is that team in place, if there's a general dentist who loves endo, who takes the continuing dental education courses, and also has an endodontist that they can refer to, and that they have a sense of where they are in developing their expertise, then they can together provide safe care to the patient. There will be some cases that are referred, some cases that are kept in the general dentist's office. And I guess my belief as a general dentist is that because the different disciplines really have different technical expertise, and they have whole bodies of knowledge. And as you take on more complex cases, you need to know the theory as well as the technical aspects of providing the care. That if you're a general dentist that's doing advanced forms of treatment, perhaps you're not doing advanced forms of treatment in all the different disciplines, right?
I guess so.
That's what I think.
I don't know many general practitioners who do everything perfectly.
Well, that's the thing.
I don't know. Like, I know people who are focused on, for example, aesthetics, or some people do. I know that do perio grafting and everything else, placing implants. But when comes, for example, to ortho, they refer. For example, I don't know anybody, honestly, at this point that I'm thinking that they do everything perfectly. and to like advanced level. At some point they limit themselves. Okay, I say, forget, I can take over of this endodontic case, I can do what is needed, but if the time comes, for example, a more difficult case, I would stop there and I would probably ask somebody else who is expert on that to perform that.
And I think that's sort of the beauty of general dentistry, is you can decide which areas you want to focus on. You can go on to do a dental specialty program. You don't have to do it immediately after graduating or after 1 year of practice. There's no time limit, right?
Absolutely.
We're talking, off camera about somebody who did a dental specialty program even in their 50s. I actually have a friend in my dental school class who decided to become a registered nurse. So she started nursing school when she was 50.
Oh.
And I know, many people who've gone on to do advanced education in education because they liked the theory of education and they combine that with their general dental degree. So we also have other topics we could speak about, but I hope that we can have another conversation at another time, perhaps, about the IDAPP program and why a general dentist from an internationally trained dentist may choose that.
Absolutely.
And we can also talk about internationally trained dental specialists and sort of what their options are when they come to Canada.
That's perfect. Absolutely. One thing that I would like to add about that, age is not something that should prohibit from what you want to be and what you like to have, considering your what you have, basically, like the time you have, the flexibility that you have, all of those things. That basically, with every step that you take, you're sacrificing something else. Obviously, if you are going back to school, you're not making that income that you are doing now. So you are giving that up in order to achieve something else. So all of these things you have to put into a balance and see what is the best move for you. And as I mentioned, in general practice, there are so many things that can be helpful. That the relationship that you have with the patient is different from the relationship that I have with the patient. So you are more a part of a family, of a patient, than I am. Even though I do my best, but I see the patient once or twice most of the time, right? But the patient has more trust to you, a better relationship to you, and that's an ongoing relationship that is very enjoyable. I would say when I was a general practitioner, that's the part that I don't have now that much, and I like that, actually. So each part of dentistry is like swimming in an ocean. Somebody swims in a deep area, somebody swims in the beach. They are different, but everybody is swimming.
Oh, that's wonderful. There's a place for all of us in that ocean, I think.
Exactly.
Yeah. So I really do appreciate your heartfelt advice and reflecting on your decision making through your career. And I look forward to the next time that we speak on camera.
Thank you, Lesia, and thank you, Prep Doctors, for this opportunity.
Wonderful.
I'm looking forward to future cooperation. Thank you.